Good evening. I'm Sandy Collier. Thanks for joining us for our 5-part series on opioid prevention education. Tonight is our final segment in this series. Dr. Brian Coleman will share with us his insights on pain management. And finally, a powerful interview with former Denver Broncos player Vance Johnson. He will share with us his struggle with addiction, from near death to recovery, to him now being an inspiration to others. This is an interview you don't want to miss. But first, a message from our executive director and our board president.
Hello, my name is Laurel Dalton and I'm the Executive Director for the T. Leroy Jefferson Medical Society. I would like to thank you for participating in our education series today, along with our wonderful expert panelists as well as the Health Council of Southeast Florida. This activity has been planned and implemented in accordance with the accreditation requirements and policies of the Accreditation Council for the Continuing Medical Education through the joint providership of Florida Area Health Education Center Network and T. Leroy Jefferson Medical Society. The Florida Area Health Education Center Network is accredited by the Accreditation Council for Continuing Medical Education to provide continuing medical education for physicians. The Florida Area Health Education Center Network designates this live activity for a maximum of 5 AMA PRA Category 1 credits, 1 credit per session. Physicians should claim only the credit commensurate with the extent of their participation in the activity. The Everglades Area Health Education Center, provider number 50-3066, approves this program for a maximum of 5 contact hours, 1 contact hour per session of continuing education credit through the Florida Board of Nursing, the Florida Board of Dentistry, the Florida Board of Clinical Social Work, Marriage and Family Therapy, and Mental Health Counseling, and the Florida Council of Dietetics and Nutrition. Before we get started, I would like you to hear a little information about our medical society and our programs in the community. Most of these initiatives were made possible by grants and donations to our organization. We also have several gift cards that will be given out to attending pre-registrants by random number selection on the first live broadcast of this webinar. And at the end of the session, please scan the QR code or follow the link provided for the required assessment for your education credit. For those viewing live, the assessment will load immediately at the end of the session. Thank you again, and please enjoy this education session.
Hello, my name is Dr. Tiffany McCullough. I am a board-certified emergency medicine physician as well as a wellness physician. I am currently the board president for T. Leroy Jefferson Medical Society for the term 2020 through 2022. I'm honored to be here. T. Leroy Jefferson is made up of healthcare professionals dedicated to improving health and wellness, access to care, academic and career development, as well as being sure to create additional opportunities for the underserved community. With opioid deaths on the rise across all racial and ethnic groups, our society has elected to educate the provider community on opioid-related issues because, truthfully, a project like this aligns perfectly with our mission. This is a 5-part series, and it is made possible through a grant from the Health Council of Southeast Florida. According to the Centers for Disease Control, nearly 500,000 people, that's 500,000 people, died from overdoses involving any opioid. This includes prescription medication as well as illicit opioids. In recent years, nearly all racial and ethnic groups are affected, and everyone has really experienced a significant increase in opioid-involved related deaths. That includes synthetic opioids and manufactured opioids. With our overarching goal to save lives, we plan to educate medical providers to give them a comprehensive and holistic approach to teaching patients with acute and chronic pain. We aim to help providers. We are using a 5-pronged solution. These measures include improving their clinical decision-making, helping to enhance their patient management strategies, helping physicians interpret new clinically relevant findings, analyze health policy, and having access to resources for review. I'd like to thank you, our viewers, for electing to take this opportunity for additional learning. We would also like to thank our team for making this possible. We ask that you would fill out the brief survey at the end of this opportunity so that we can know how to best serve you in the future. A special thanks to the Health Council of Southeast Florida for making this project possible. If you would like to know more information about T. Leroy Jefferson Medical Society, please visit us at our website, which is tljmedicalsociety.org. Again, tljmedicalsociety.org.
I'm Sandy Collier, and joining us for this session is Dr. Brian Coleman, orthopedic surgeon. Dr. Coleman, thank you so much for being here with us. Let's start with, tell us a little bit about yourself and your practice.
Well, as you mentioned, I'm an orthopedic surgeon. I specialize in foot and ankle surgery. My practice is in Delray Beach primarily, and I've been practicing orthopedics for almost 30 years.
Wow. So let's talk a little bit about opioids in terms of surgery. As a surgeon, what training did you receive pertaining to prescribing opioids?
Well, Sandy, that's part of the challenges we have today is we really back in the 1980s and 90s and even in the 2000s, we had no formal training with regards to prescribing opioids and how to utilize them and what to look for. It's sort of been a situation where we learn these things on the fly. What I mean by that is when we were in our early years of training, there was aggressive marketing by pharmaceutical companies, and all you hear about were the great things that comes with opioid use. You didn't hear about the addictive properties and the nightmares that come as a result of that. Even for our organization, the American Academy of Orthopedic Surgeons, there was a large emphasis 20, 30 years ago placed on pain assessment and the importance of that and understanding the pain that the patients are in. Understand that the whole foundation of practicing as an orthopedic surgeon is based on pain that a patient has. So obviously, understanding the pain, if it's legit, how to manage it, is a fundamental tenet of how we practice on a day-to-day, week-to-week basis. In addition, there was a growing fear that the traditional non-steroidal anti-inflammatory medications that we utilize so regularly, and it actually was pretty much our go-to medication, there was some literature out there that spoke to anti-inflammatory medication having a negative impact on fracture and bone healing. So with this belief from the literature we were presented, along with the emphasis on opioid use, it was a perfect storm to increase opioid use as a regular practice and treatment plan. What we've learned now is that those studies that basically said traditional non-steroidals negatively impacted bone healing are not really true. They were primarily sent out by the pharmaceutical companies in an attempt to promote the opioids. That's what we're finding out now. We now understand that those studies had flaws with regards to number of patients, how long they were trialed in these particular articles. And now that belief is not really something we adhere to in our practice.
So, doctor, what are some alternative treatments to opioid prescriptions?
That's an excellent question, Sandy. When we see patients, we have certain clinical cues, I call them. Buzz phrases like the patient says, I have a high pain tolerance. Only certain narcotics work. They get into specifics on the dosage. Those are things in the history portion that we look at that give us pause with regards to this patient potentially being an abuser of opiates. So there's other things like a history of anxiety, depression, benzodiazepine use, chronic pain, and of course, obviously a history of prior substance abuse, them seeing a pain specialist for management, and a lot of times the patient will display an agitated or anxious behavior, inconsistent physical exam. These are the things, at least in the initial interaction, we look for. So as you're getting a history, as you're formulating a diagnosis, and as you're putting together a reasonable treatment plan, you have to factor in how the patient's issues will be managed. Typically, for me, the lead hand is if they are a surgical candidate, which we will speak of today, what the level of surgery they're going to have, meaning that is it something that's going to require an inpatient stay, the length of time, the amount of soft tissue and bony damage that will be implemented as a result of me fixing whatever needs to be fixed intraoperatively. So once you factor in the surgical execution piece, then you have an idea about what tier the patient falls in terms of how much pain they would require, or pain medication they would require. Typically, for any medium or major level of surgery, preoperatively, I will lay out in detail my post-op management plan to the patient so they understand at 1 week, at 2 week, at 3 week, at 6 week, at 10 week, exactly what they'll get from me. So you already create a mindset of you're going to be boxed in regards to what I feel you need and what you should have. Now, obviously there are exceptions. Any postoperative complications, obviously you take into account the subjectivity of the patient, understanding what the history is. You know there are probably those that have been on pain management and have been on medications, whether it's opiates or benzodiazepines. You understand from your experience that they're also going to require it longer than the average patient that is not. It's in those instances where I will implement, even though it's an opiate, it's less potent tramadol medication in 6 weeks, where I might not in other cases. I will start having a conversation about anti-inflammatories, topical medications, lidoderm patches. Then we have a whole armamentarium of physical therapy modalities, whether it's heat or cold, massage, electric stim, phonophoresis, ionophoresis, TENS unit. All those things can be implemented that are non-opioid methodologies that will help manage the pain for this patient. If this patient has a fairly significant history, I will immediately introduce, at some point, you may require a pain management specialist to intervene. That's typically how I approach these patients.
Wow. So what factors, whether physical, mental, or social, influence your decision when prescribing opioids to patients?
Well, again, as we had previously talked about, their history and having a previous usage is very significant. Because what we do know, that subsequent studies show, at least in the orthopedic field, that if patients have prior use of opioid use, and that if they have taken it over 12 weeks prior to seeing you or prior to the surgery, approximately 50% of all of those patients will be taking some level of opioids for the next 5 years.
Wow.
That's what we understand. So the history portion, their social behavior, whether they're a smoker or a social drinker daily, again, how they are displayed, what they dictate to you versus what you dictate to them, these are all things that are factored into those decisions.
Dr. Coleman, thank you so much for sharing all of that information with us. We have a lot of medical professionals listening to us right now. What advice do you have for them?
Well, I'll speak for my specialty. My advice is, we say it all the time, the history is very important. The nonverbal communication in that initial office visit is critical. Patients can tell you so much without talking to you. You can hear what they're saying, but if you look at what they're doing, there'll be subtle cues that oftentimes will tip you off on a patient that's at risk. And then, as I've previously stated, outlining in as much detail as possible your specific post-op regimen for the procedure you're proposing, I think gives everybody involved in the process a clear understanding of where you are with things. They have goals to commit to. You have restrictions and guidelines that you adhere to. And if things happen where the party goes outside those guidelines, then you offer very quickly and very early a pain management specialist to sort of take over that portion of your care.
Doctor, thank you so much for your service to our community. We'll see you next time.
Thank you.
And joining us for this session is Vance Johnson. You remember him. He is a former NFL wide receiver, and he's had a battle with opioids, and he's going to talk to us about his battle today. Mr. Johnson, thank you so much for being here. First of all, tell us about your first experience with opioids.
Well, let me say how excited I am to join you. I think this is just so important, especially during these times where we're able to get together, that we have these Zooms and these other ways to just really get the word out there and to continue to educate everyone. And so I'm blessed to be here to share my testimony with you and to offer hope and to share what's really important in my eyes is how important doctors and physicians are, especially during this time where people are struggling and they can't reach out for help, but yet they have someone that cares a lot about them and that knows some ways to show them the way out of the darkness that they're living in. And that's these physicians and doctors. So to start a little bit of my story, before I get into how I really got involved with the opioids and different types of medications, I want to talk about where it all started. Now, when I was a child, to me, I grew up around a lot of trauma. My father was very abusive to my mother. He had a lot of affairs. There was a lot of addiction in my world as a kid. And so to try to get away from it, my job to me was to try to figure out how I was going to make something of myself, because what I grew up around, I didn't want to be like. So I started to just really think that my life and my identity had to be something I had to achieve. So what I did then was I started to watch and focus on sports and working really hard to try to make myself into something, thinking that somehow I would get away from the craziness that I had to grow up around, not knowing that emotionally I was struggling. So as time goes on, I get through junior high school and my sports doing really well. I get through high school. I'm one of the best in the world, actually. In fact, I go over and win the gold medal for the United States of America in the Pan American Games for Junior Olympics. And then all of a sudden I get drafted by the Denver Broncos, second pick in the second round. So I'm thinking to myself, I don't have any drugs in my system. I don't use any drugs. I'm not drinking. I'm not taking any pills. I'm not doing anything. I finally made it. So when I got to Denver, Colorado, I didn't know that once I started to try to cope and deal with things that were happening in my life at that time, that I was going to have to lean on different types of drugs and alcohol and relationships to try to cope with life. Well, it happened. And that's when I started to have injuries during my career. And I would see guys getting these shots. I would see guys taking these pills before the games and during the games. And I realized that those were something that I was going to have to start leaning on because of the injuries. And what I found out was when I took pills, I felt better. So, and, it was really traumatizing to me to know that whenever I wasn't on the football field, which that was only the edited version that people saw of me, when I was off the field, the only way I dealt with the injuries and I dealt with even my emotions was by taking these opioids to not only get away from the pain that I was feeling because of the injuries, but literally to deal with even the emotional and mental stuff that I was going through at the time, not realizing it was going to lead to an addiction.
So, what was your lowest point? What would you say was your lowest point, and what would you say was your rock bottom point?
It took a lot of years for me to hit my lowest point because for some reason, being a successful, well-known athlete, people didn't see me as having a problem. And I didn't see myself as having a problem. That was for the people who didn't make it in life. To me, just because I was taking a whole bunch of opioids didn't mean that I wasn't a drug addict, if that makes any sense, And because when I met with doctors during that time with my injuries and the prescriptions that I was able to get, I was taking 15, 20 plus pills a day throughout my career. And even after my career, after 10 years and 3 Super Bowls, the pain didn't go away, not physically and not emotionally. And so I started to lean on those things even more. And that's also when I started taking antidepressants, sleeping medications. I was taking oxys, I was taking codeine and morphine, Vicodin, anything I can get my hands on just to get out of me because I didn't want to feel anymore. Not knowing that when I visited these doctors sometimes, what they would do because I was a famous athlete is just prescribe whatever I needed. Well, I ended up actually having a really serious problem with my addiction, and I almost died one time. In fact, I had an accidental, and I'm going to show, I don't think you can see it, but if anybody can see that injury on my arm, that was one of my accidental times trying to kill myself. And so I ended up actually ODing. They brought me back and told me, Vance, you may lose your arm because of what you've done to your arm. But I woke up, I continued to lean on addiction, to use. And finally, one day I called my mother. I was drinking and taking so many different pills and told her I was going to die. She raced over to pick me up and we went to the hospital. And by the time I got to the door there at the emergency room, I fell on the ground and literally fell into a coma. And so for 28 days, I was in a coma. And at day 24, after they took the respirators out of me, they ended up actually taking them out and watching me. It was my deathbed. And I have a deathbed picture. I'd love to send it to you so you can share that so people can see I'm not just an athlete sitting here trying to inspire people. I'm sitting here using my transformation to help, my transparency rather, to help somebody with their transformation. So I hit rock bottom because I was only coping and dealing with the pain that I went through by using.
Wow. So this is so fascinating. And I got to thank you again for sharing with everybody who's here. At what point did you say enough is enough? I can't do this anymore. At what point did that light, went off in your head for you?
What's really, really interesting is I ended up actually relapsing after I left the hospital from being in that coma. And I met a doctor who, for some reason, this doctor would not give me any more drugs. I wanted opioids so I can cope with what I was dealing with, because to me, I felt like that would make me feel better. But he kept saying no. And I was like, dude, what are you talking about, man? I've got injuries from my NFL career. I need some pills so I can not feel what I'm going through. He actually, and this is what I want to share with the people that are watching this, because I know you have a lot of therapists and doctors and physicians that are watching this stream, that you are the key. And I know you care. And because it used to be the front lines with the cops, but for some reason now people don't want to trust cops. If not you, then who? It's a doctor who literally talked me into understanding that I was struggling with a lot more than just taking these pills and stuff, trying to figure out how I was going to get through my life. But it wasn't until I just was driving through a canyon one day and I was screaming and crying out to God, because I'm a man of faith. And I thank Dr. Mark Twardowski for 3 years keeping me off opioids. And then I leaned on different types of alcohol until I just cried out one day and just realized I had to go get help. And so I literally reached out to the NFL, and they paid for me to go to treatment because I was $1 million in debt. And when I went out to treatment, I started to learn about addiction. I started to learn that I was struggling with a lot of underlying issues. And that's what much of this generation, especially right now, is suffering with, is a lot of the trauma that they've gone up in life, and they're leaning on addictions. And so I want to encourage all the physicians that are watching right now to please use that gift that God gave you to save lives.
How long have you been clean?
I've been clean now for a little over 6.5 years, and I am just so blessed because now I know the whole reason I led the life that I led was so that I could be in this position and on this stream with you today to share hope and let people know that this is your testimony in this life. There's a gift that those doctors have to help save lives, and there's a gift that people that are in recovery have to go out and share their transparency, leading to not only their transformation, but somebody else's. And that's what I'm going to do. In fact, and I'm going to add this in there, I've recently been casted and asked to be one of the main interventionists on the show A&E Intervention.
Wow. Well, sir, I'm going to ask you, because every single one of us possibly knows somebody that has an addiction. And I personally know within my own family that, that's struggling, with addiction. What do you say? And I want you to speak directly to the person out there that's struggling with addiction, that does not think that they can get off of this. I want you to speak heartfully to them right now.
First, I'm going to let those loved ones know something. You cannot love somebody out of their addiction. You can love them through it. I hope you got that. You can't love them out of the addiction, because all you're going to do is enable them, and you're going to keep on just giving them what you think they need to help them stop, but they're going to keep going because they can't by themselves get off of it. But you can love them through it. And so I'm going to encourage you to just be as transparent as possible with your loved one and let them know that when you hit rock bottom, I'm going to be here to help you. And that's the other reason why I'm in this space now, because I want people to either reach out to me if they need someone to do an intervention, reach out to me if I can even just talk to someone, share my testimony. I'm that transparent, and I'm not that famous guy anymore that I want to exalt myself. I want to keep myself humble so that I'm there to help people that might need a loved one to get into treatment. Also, if I may, I have Advanced Care's website where you can go onto, and we have a number of mental illness hospitals right there in Florida, about 4 or 5 of them, that we can help people that are dealing with dual diagnosis, especially when they're struggling with different types of opioids and any other type of addictions and underlying issues. But you need to just reach out. But those loved ones who have someone who's struggling, you can love them through it, but you can't love them out of it. And if you are suffering with an addiction, I need you to reach out for help.
Sir, one of your Arizona Wildcat friends, international player Morgan Taylor, said he is so proud of you. and to keep up the good work, and he'll see you soon.
Oh
We have
my gosh, thank you so much for that, because you know what's really strange? I thought I was better than everybody else when I was at college and even when I was in the NFL. And I'm just so thankful that guys like him were just continuing to pray for me and that are watching my story right now just play itself out. And so let me first say to them, I'm so sorry that I was a selfish, self-exalted son of a gun. I don't cuss anymore. I sure appreciate your support, guys. I love you guys so much. It's about team.
Thank you so much, Mr. Johnson. You have been an inspiration to all of us, and thank you so much for sharing your story. I can't thank you enough.
I thank Jesus Christ for everything he's done for me, and I thank you guys for allowing me to be on your stream today.
I'm Sandy Collier, and thank you all for joining us.
Hello, my name is Dr. Carl Michel. I'm a foot and ankle surgeon and current board member serving as parliamentarian and health education chair of the T. Leroy Jefferson Medical Society. Thank you for taking part in this opioid prevention education series. This 5-part series was made possible through a grant from the Health Council of Southeast Florida. We hope this series helped you to improve your clinical decision making, enhance your patient management strategies, interpret new clinical relevant findings, analyze health policies, and gain access to resources for review. On behalf of our organization, we would like to thank you for electing to take this opportunity to learn. We also like to thank our team, and especially the Health Council of Southeast Florida, for helping to make this project possible. For more information on T. Leroy Jefferson Medical Society and how to become a member, please visit our website at tljmedicalsociety.org. That's tljmedicalsociety.org. We would love to have you. Thank you.